So, got Christy here, Christy Strong, and we are doing NMES protocol for leg extension. We've EFS'd first, so I energized the body. I got the entire body electrified, DC current with electromagnetic wave to get to, again, we're going after scientifically improving the neural response to the tissues. So, here, got AC stem device. This is the MP3 300. And I already did the left leg, and she has a response. Her hip flexors engage, her tibialis anterior engages. The quadriceps respond, but the leg just more lifts like that in response to the stimulus of the stem. It doesn't smoothly extend. So I recalled, went back to my textbook. When I was at Next Step, we had plenty of gentlemen and women that came that I massaged before the sessions, and their bodies responded better to E-stim. So this is about getting a better response to E-stim. What happens with spinal cord injury is the muscles atrophy. And when muscles atrophy, they clamp down on the nerves. So the signaling is not going to be as good going to the brain and back down. Doesn't matter who you are, doesn't matter how long you've been injured. What matters is that you separate the fibers. I could show you other videos or other pictures where my bodybuilder guys, I was able to separate his fibers and volumize his back in one session. So to help him get ready for his show. So in this case, I used my rock blade for not even 2 minutes. Right now I got the pads on, and this is ultrasound gel. Ultrasound gel helps improve the conductivity, especially if your skin is dry. You just get any ultrasound gel, it dries, it gets sticky, But with the rock blade, I just, for about 2 minutes, used the broad edge. Shout out to Rock Blade, Rock Tape. My first certification getting my massage after my massage license. It separated the fibers. I got blood flow and nutrients going already to the tissues. So that's good blood flow and circulation. That's good for the health of her skin, good for the health of the muscle. And now the E-stim is going to be good for not just the muscle. It's also going to be good for the bone, because we're bone density. We've already shown that bone density is lightly affected by the contraction of the muscle ends pulling together. When they pull together, they put pressure on the bone. If you overcontract the muscle, and your bone is weak, you'll snap the bone. There's been some physical therapists out there at a big name hospital nearby that's done that.
Wow.
Yeah, there's a small community. Things get circulate pretty quick. So nonetheless, so her bone density is good because I make sure she stands. She has a standing frame at home. I have a standing frame here. I got the vibe plate. She's going to be standing after we do 15 or 10 minutes of NMES standing here, and then I'm going to transition the E-stim pads to her glutes to help keep her hips pressed forward. So in this act, all I'm going to do, after I've already bladed her leg, I'm going to run the E-stim. We're already set with the ultrasound gel and the pad placement. Now, up here is the hip flexor group. If you come too high up, it's going to make her leg lift upwards and not fully extend. So you have to be careful with how far up you go and then how far down. Minimum 2 finger from the joint, 3 finger minimum separation. This is all white down here, so you get connective tissue as the muscle ends tapers off. So you want to come up a little bit, definitely be away from your knee when you do this. So right now, I got the one channel running on the E-stim. Here is 20 milliamps, there's 30, there's 40, 50, 60, and there it goes, it's coming, 70, and at 82, we got full extension. Do I need to keep going to 100? Not necessarily. That's going to give me room for when as the muscle fatigue, I can try and keep that same force present. Or I can just, hey, this is how much stim it took for how long. When her leg no longer extends this high on its own, then I know the muscle has fatigued. Muscle physiology. So muscle fatigues, then I know that's why I was able to gauge. I wanted to do 15 minutes. We ended up doing 10 because the muscle was tired. It wasn't barely responding anymore. So I'm going to keep going and push the time. So you have to graduate that approach over time. So she's thinking about every time the muscle engages, you got an amber light on the device, and I can get from under there. She can see the amber light. She can also see the muscle respond. So again, when I rock bladed her thigh, after I use the massage cream, so I use alcohol wipes to wipe that cream off to apply the ultrasound gel to get a good quality response. I'm just cueing the foot into dorsiflexion as she extends. Because when you walk, guess what happens? You dorsiflex into extension or into flexion as the knee extends. So that's just a cue there. She has a sensory cue there. I don't need to be tapping the end of the patella tendon. I could, but it's right here. And there we go. So I'm just dorsiflexing the foot. I'm not lifting the foot. The stem is doing it. Good to go.